Assalamu alaikum wa rahmatullah. Bismillahir Rahmanir Rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. আজ আমাদের আলোচ্য বিষয় গ্যাস্ট্রোইন্টেস্টিনাল ডিজঅর্ডার্স। Gastrointestinal disorders, spectrum of gastrointestinal disorders. Gastroenteritis is a syndrome with gastrointestinal symptoms, that is nausea, vomiting, diarrhea, or discomfort. Diarrhea, you all know, diarrhea according to WHO, frequent and or fluid stool. Dysentry, stool with blood and mucus accompanied by pain, fever, or abdominal cramp, usually associated with large intestine pathology. It is an indication of inflammatory disorder of large intestine. Enterocolitis, inflammation of mucosa of both intestine. Food poisoning, infection associated with consumption of contaminated food, also known as food-associated infection. Prevalence of diarrheal disease. Still, it is one of the top 6 causes of death in the world, and every year 1 billion, that is 100 crores of children under 5 suffers, of which 33 lakh dies. Etiology of diarrheal disease. The infectious etiology and non-infectious. Infectious etiology include bacterial cause, viral cause, protozoal cause, and fungal cause. There are bacterial etiology. There are about 9 to 10 bacteria. The classical agents are Shigella and Salmonella. Vibrio cholerae is prevalent during epidemic. Campylobacter jejuni. Diarrhoeagenic Esch coli, that is enterotoxigenic Escherichia coli, enteropathogenic Escherichia coli, Enteroinvasive Escherichia coli, enterohemorrhagic Escherichia coli, enteroaggregative Escherichia coli. They cause all types of diarrhea, starting from invasive to watery. Aeromonas or Plesiomonas, there is a question mark. They sometimes they are considered as cause of diarrhea. Yersinia enterocolitica is also a member of the Enterobacteriaceae. It causes diarrhea. Staph aureus, Bacillus cereus, Clostridium perfringens, they mainly cause food poisoning. Viral etiology. Rotavirus is the most commonest cause of watery diarrhea among the children. Besides rotavirus, there are Norwalk virus, calicivirus, adenovirus, and astrovirus. Protozoal etiology. You all know the classical 2 agents, Enterotoxin histolytica and Giardia lamblia, of which Enterotoxin histolytica causes invasive diarrhea and Giardia lamblia non-invasive diarrhea. And in immunosuppressed population, Cryptosporidium parvum and Balantidium coli, they also cause diarrhea. Let us examine the prevalence. This data was taken from ICDDRB study. This research was carried out during the period of 1996 to 2001. Vibrio cholerae 1, classical Vibrio cholerae, was responsible for 20% of all ages, but when less than 5 years of age, 12.1%. Vibrio cholerae 0139, also known as Vibrio cholerae bengal, 2.9% and 6% respectively. Shigella species, 6% and 5.6%. Rotavirus responsible 37.9% in case of children and 23.7% in all ages. Escherichia coli, all varieties, ETEC, EPEC, enteroaggregative and enteroadditive, 34.9% and 43.6%. Campylobacter also responsible for a good number, 9.5 to 11%. Salmonella 2 and 1.6%. Among the protozoal agents, Enterotoxin only 1.2, Giardia lamblia 1.6, Cryptosporidium 0.7. And no pathogen could be isolated in 19.6% in case of all ages and 17.5% in case of less than 5 years age group. Possibly these were not infectious diarrhea, or maybe by the mechanisms we use, we could not isolate them. There were mixed pathogen in 31.6% and 36% respectively. So if we summarize, you can see in the top of the list, Escherichia coli, 43% less than 5 years age group, 34.9% in all age group. Rotavirus, second important, 37.9% and 23.6%. Vibrio cholerae, O1, 12.7 and 22.9%. Campylobacter, fourth position, 9.5% in all ages, and in case of children, 11%. You see the classical pathogens prevalence is nowadays less. Shigella, 5 to 6%, Salmonella, 1.6 to 2%, and no pathogen, 19.6% to 17.5%. What are the mechanisms involved in diarrheal diseases? There are more or less 3 mechanisms, broadly 2, invasion and non-invasion. Invasion of GIT, number 1 pathogen is Shigella, followed by Campylobacter jejuni, and some strains of Escherichia coli, like enteroinvasive Escherichia coli, enterohemorrhagic Escherichia coli. Among the protozoa and histolytica, Salmonella has both the mechanisms. Non-invasive diarrhea, which is again of 2 mechanisms. One is due to a enterotoxin production, Vibrio cholerae and Enterotoxigenic Escherichia coli, and due to decreased absorption, rotavirus, Norwalk agent, and Giardia lamblia. Pathogenesis of Salmonella enteritidis, it involves both the mechanisms. One is invasion and another one is cytotoxin production. Mechanism of action of cholera-toxin as well as ETEC, heat labile enterotoxin of Escherichia coli. This toxin binds with the intestinal epithelial cells by B subunit. It has got another subunit A, which enters into cells and activates adenine cycles. It increases the concentration of cyclic AMP within the cells, resulting in hypersecretion of water and chloride and inhibition of reabsorption of sodium. Intestinal lumen is distended with fluid and there is hypermotility leading to profuse diarrhea. Same mechanism for enterotoxigenic Escherichia coli. Pathogenesis of rotavirus diarrhea, 3 mechanisms are involved. Number 1, it infects the epithelial cells of the small intestine and multiplies in the tip of the villi, resulting in death and desquamation. There is reactive hyperplasia of the crypt cells. These 2 effects is responsible for decreased absorption of fluids and nutrients and increased secretion of fluids. A third mechanism is nowadays is also proposed, a viral protein that stimulates the nervous system of the intestine that causes increased secretion. And usually regeneration of the villi occurs in 1 week time. Pathogenesis of protozoal diarrhea. Enterotoxin histolytica, it is an invasive pathogen. It causes diarrhea by local invasion and inflammation. And Giardia lamblia, it is non-invasive. It causes diarrhea by mechanical interference. Cup-like disc of the trophozoite adhere to the intestinal epithelial cells and thereby interfere with absorption. Now discuss about the laboratory diagnosis of diarrheal disease. As I discussed in my previous lectures, there is a principle for diagnosis of all microbial diseases, and similarly here also the principle is the laboratory diagnosis is based on demonstration of the causative agent by microscopy, isolation and identification by standard bacteriological culture, by immunological test, molecular techniques, and some special tests are involved in the diagnosis of diarrheal diseases. You see, we need freshly passed sputum, stool or rectal swab, and on microscopy of the weight preparation and iodine preparation, by saline or iodine preparation, we can differentiate the diarrhea into invasive and non-invasive nature due to by the presence of past cell, macrophage, and RBC. By iodine preparation, we can see the cyst of histolytica and Giardia, and by modified gel Nielsen preparation, we can detect the oocyst of Cryptosporidium parva. So microscopy has got a good role to play. Isolation and identification, McConkey agar, Salmonella, Shigella agar, TCBS, and Campylobacter agar, depending on the provisional diagnosis to be by the physician, and to be incubated usually at 37 degrees centigrade aerobically for usual pathogens. But for Campylobacter, we need to incubate at 42 degrees centigrade and microaerophilic conditions. So culture is not that easy. And immunological test, we can detect the rotaviral antigen and Clostridium difficile toxin from stool by latex agglutination or other rapid test. A special test for the Diarrhoeagenic Escherichia coli, that is ETEC, EPEC, VTEC, enterohemorrhagic. Special tests are done in the reference lab, and there are different tests for different strains. But nowadays, molecular technique, that is multiplex PCR, can be done for Diarrhoeagenic Escherichia coli, and polyacrylamide gel electrophoresis can be done for rotavirus. You see, even in the tertiary laboratory of the medical college, we will miss about 35%, 30 to 35% of Diarrhoeagenic Escherichia coli by these procedures. And if we do not incubate 42 degrees centigrade microaerophilic condition, we will miss the Campylobacter. And you all know rotavirus cannot be cultured in artificial media. So stool culture, routine stool culture is not at all helpful to reach a diagnosis. And if we want to identify all the bacterial strains for diagnosis, even that it will cover only 76%, and the cost will be much higher because molecular techniques is to be applied for diagnosis of enterotoxigenic, enterohemorrhagic, enteropathogenic. That's all diarrhoeagenic Escherichia coli. Rather, microscopic examination of the stool is very helpful because by microscopic examination, you can differentiate the diarrhea as invasive or non-invasive, or you can identify the protozoal diarrhea from the microscopy only. And if you suspect a Cryptosporidium diarrhea, you can advise modified gel Nielsen stain. And by the careful examination of careful interpretation of the microscopic result of a stool, you can decide whether you will use antibiotic or not, because most of the rotaviral diarrhea does not need any antibiotic, and most of the watery diarrhea are also can be treated by fluid and electrolyte balance. Only the Shigella needs the anti-Shigella, and Shigella needs the Campylobacter jejuni, they need antibiotics. So careful interpretation of microscopy is much more helpful for management of the diarrhea than routine culture. Thanks for watching. Please subscribe my channel. Thank you very much. Assalamu alaikum wa rahmatullah.